Hi, my name is Marisa. This is Nursing 612, the final head-to-toe assessment. This is my mom. She's going to be my volunteer today for this. Prior to coming in here, we've emptied her bladder. We've done a full set of vital signs, including a temperature. We've done her height, her weight. We've done the Snellen chart. We've checked cranial nerves with the smell test and the taste test. Now we're going to present with the actual physical hands-on exam. I'm inspecting her head and her face as far as symmetry, the skin, hair distribution. I'm going to feel her head, her hair for texture, making sure it doesn't come out when I run my fingers through it. Checking, see if she's got any knots or lesions. I'm going to palpate her frontal bones. I'm going to also, while I'm here, go ahead and inspect and palpate the ears, noticing the how symmetric they are to the face. I'm also noticing the symmetry of the eyes. Can you take your glasses off? I'm palpating the frontal sinuses, palpating the orbital sinuses, also palpating the lacrimal apparatus, palpating the bridge of the nose, palpating her temporomandibular joint. Can you open and close your mouth for me? Okay. And her mandible. While I'm here, I'm going to palpate her auricular lymph nodes, her post-auricular lymph nodes, her superficial, post-clavicle, supraclavicle, deep clavicle, occipital, as well as axillary. Can you lift your arms up for me? As well as axillary. We'll have her swallow. I'm going to palpate her thyroid. Okay. I'm going to take a look at your eyes and just leave your glasses off for me. We're going to check eye reflex. Just stare at my nose. Okay. I'm also noticing the hair distribution of her eyebrows and eyelids, eyelashes. I'm going to check her sclera and conjunctiva. Nice and pink. Like I said, we've already done the Snellen chart, so now we're going to do the near vision screening. This is 14 inches away from her. Which line can you read? Read me the numbers.
2843.
Okay. How about with your glasses on? That was 2070 without her glasses?
8745.
Okay. That is 2025 with her glasses. And her pupils on coronary reflex was a 3 brisk bilateral. They were perla. Now I'm going to assess her red reflex. You stare at that point on the wall. Oh, take your glasses off. I'm sorry. Now stare at that point on the wall. Okay. Now the other side. Good. Now I'm going to check your hearing with the tuning fork. I want you to tell me if you hear it in your left ear, right ear, or both.
Left. Both.
Okay, you hear it in both?
Mm-hmm.
Okay. Now I want you to tell me when it stops.
Stop.
And tell me when it stops. And again in the other ear. Up. Up. Okay. So you notice air conduction is twice that of bone conduction. I've already assessed the exterior portion of her ears. So now I'm going to inspect the ear canal and eardrum. No need to be pearly white. No obstructions. We're going to do this ear. So you can just look at. Okay. Good. While we're at it, I'm going to look. You can put your glasses back on. I'm going to look at the openings of the nose, inspecting the septum, and look inside the nose, looking at the turbulence, hair distribution. Okay. You open up and say ah for me. Ah. Noticing the pillars, her uvula, the hard and soft palates, her buccal, her teeth, noting the size, the count, looking at her tongue, the structure, her teeth. Can you move your tongue to the side so I can look at the lateral aspect of it, or the side of it? I want the other side. All right, lift your tongue up, looking at the base of her gums. All right. Now I'm gonna gag you and check your gag reflex. Okay? And you open up and say ah, ah. Okay. Good. And check for sensation on your face. Can you smile for me? Can you clench your teeth? Can you puff your cheeks? Can you tighten your eyes and open and wrinkle your forehead? Okay? I want you to tell me if you feel the soft sensation, if it's equal on both sides.
Yes.
And how about on your cheeks?
Yes.
And your chin?
Yes.
Okay. Right. We've already inspected and palpated her lymph nodes of her neck. We're now going to palpate her carotid pulse on the left side and then the right. I've already felt her thyroid gland. We're now going to listen to her carotid arteries. First with the diaphragm, and then with the bell. We're also going to listen to the thyroid gland with the bell of the stethoscope. All right. Turn around to the side for me. I'm going to inspect her back. Skin color, temperature. I'm going to inspect her cervical spine, noting that there's no abnormalities, there's no kyphosis. We're going to palpate her clavicle, her post-clavicle lymph nodes while I'm back here. We're going to percuss. Comparing the right and left sides. We're also going to percuss on the lateral sides, comparing. We're going to check tactile primitus. When you feel me touch you, can you repeat 99?
99, 99, 99, 99.
And again?
99, 99, 99, 99.
I'm also noting her breathing regularity and depth. She's got normal, regular rate and rhythm. As she breathes, can you take a deep breath in? I'm feeling for symmetrical breathing and out, and in and out. My hands are going up and down at the same rate and the same distance apart. When you take a deep breath in this time, can you hold it? Check for diaphragmatic excursion. Okay, and breathe out and hold it. There's a 3 to 5 centimeter distance there. That's normal. We're going to do it again on the left side. Can you take a deep breath in and hold it? And let it out and hold it. That again is 3 to 5 centimeters. She is approximately 4 on both sides. While I have her turned this way, we're going to test the whisper test. I'm going to say something. Can you repeat what I say?
Yeah. How are you?
Good. And go ahead and listen to your back, comparing each side. As she takes a deep breath in and out, comparing the right side to the left side. The lateral sides. Okay. Good. I'm also going to palpate her kidneys while I'm back here. Tell me if this hurts.
No.
Or percuss her kidneys.
No.
Okay. You swing back around. I'm going to inspect her chest, her skin area, noting color, temperature, no irregularities from lesions noted. Place my hand here. Notice her regular rate and rhythm. I'm also feeling for any heaves or thrills from her aortic, pulmonic, Erb's point, mitral and tricuspid area. We're going to percuss. John. Good. Now we're going to listen to breath and heart sounds. Breath sounds will be first. Again, comparing the right to the left. And lateral sides. I'm going to listen to the aortic valve, pulmonic, Erb's point, mitral, and tricuspid. Okay. Lay back. Okay, as she lays back, I'm going to pull her gown up. We're going to inspect the skin. Also going to look for jugular vein distension now that she's back at about a 45-degree angle. Again, looking for any heaves or thrills. Shine a light across her belly, her abdomen region to see if we notice anything abnormal. Going to palpate. Noticing this, I'm inspecting the skin for any abnormalities. I'm going to percuss her abdomen. No, I'm going to auscultate first before I percuss. I'm going to listen in the 4 quadrants for vowel sounds. If I didn't hear any, I would listen for approximately 5 minutes before calling them absent. However, I do hear active vowel sounds. I'm going to listen to the right renal artery, the right iliac artery, left iliac artery, right femoral artery, left femoral artery, and the aorta. No thrills were noted. Now we're going to percuss lightly in all 4 areas. Note if she has any tenderness. Anything bothering there?
No.
We're going to do a little deeper. We're going to palpate for the liver and the kidney. Come to the other side and palpate for the left kidney. Okay. Can you sit up for me, please? Okay, we're going to go back to the arms and the hands. While we're still in the upper body, we're going to note the nail beds, check for cap refill, the skin color and temperature, hair distribution. Check her pulse, her brachial pulse. That was a radial pulse. We're going to check her brachial reflex. We're going to look at this hand. We're looking at the cap refill. We're looking at skin distribution, hair distribution, skin color and temperature. Checking pulses. Checking reflex. Good. Okay, can you make a fist for me? Can you open your hand and flame your hand out? Okay. Do your hand in a circle. Be Superman. Up like this with both. Straighten them out. Raise them up. Put them by your side. Cross one across your body. And the other way. Okay, can you squeeze my fingers? As tight as you can on both. Great. Okay, we're going to look at the legs. Noticing skin color, temperature, equal. There's no lesions noted, no bumps, knots. I'm going to check her dorsalis pedis, her posterior tibial pulses. I'm going to check the popliteal pulse. Can you raise your foot up and push your foot down? And now your right one, push your foot up, push your foot down. Now against resistance, push toes up, push toes down. Okay. Again, we're going to check her Achilles tendon reflex. Okay. Good. All right. Can you roll your ankle, your right ankle in a circle? How about this one? I'm going to check your popliteal reflexes. All right. And your own. Good. Now can you straighten your knees out and bend them? Good. Can you stand up for me? Okay. Can you bend over like you're touching your toes? And notice her spine. There's no curvature all the way down. She's in a straight line. There's no scoliosis. Okay. I'm going to hold on to you here. Can you take your right foot and take it out to your side? And then back. We're adducting and abducting her legs. And again with the opposite leg. Good. Can you squat down? Good. And back up. Good. That concludes our head to toe physical exam. Thank you.